I want to a conversation for this hour.
Yes.
You've been talking about it.
I've been talking about it
dog
as
mom.
I'm a dog mom. Dr. Pauline Gitonga, a veterinary surgeon and senior fellow, research fellow at the University of Nairobi's SEMA. 15 years experience in tackling livestock and zoonotic diseases in Kenya's drylands.
Yes.
Okay, I want to get into that to fully understand it. But, you know, off the bat, and I know we'll go into the quote, the first thing I wanted to find out about is this thing about 2,000 Kenyans dying each year.
Yes.
Is that accurate as a result of
Yes,
rabies?
it's accurate and actually an underreported
Underreported.
figure. Yeah.
This is why we thought it was important to have this conversation on Sunday, which was which date? Sunday was the 28th of September,
Yeah.
World Rabies Awareness Day.
Yes.
So you're listening, you're watching, you have to understand that sometimes it's not as far removed from you.
Yes.
And that's why this conversation is important.
Yes.
But first, I'll take us to today's quote, Daktari. Read it to you, see what you get from it, see what it means to you, and share that with us. It's from Nuruddin Farah, who's an author, a poet. And in one of his novels, he once said, "Silence is also a language. It can scream louder than words."
That is true.
What do you make of that?
In the rabies context, the fact that there's high underreporting, it means there's silence. People are far removed from what rabies is in the community until you get a relative or your dog bitten. And it speaks loudly because rabies is one of those diseases for humans that you don't want to see a patient undergoing rabies infection. And you know it's 100% fatal when the clinical signs start. But the most interesting thing is that with all this silence, we have a vaccine that has worked for 140 years. Did you know that?
100, there's a vaccine.
There's a vaccine for humans that has worked for 140 years. But still we're having deaths in rabies.
Vaccine means get injected before.
Yes, so we have a dog vaccine and then we have a human vaccine. And the vaccine, both that were all have the same what you call biological, has been in existence for 140 years. So the silence is that why are there no reports?
Why are so many people dying?
And why are so many people? Because this is 59,000 in the world, 2,000 in Kenya.
2,000 every year.
2,000 every year.
Let's start from the basics.
Yes.
What is?
Apart from just calling it kichacha umbwa,
Yes.
what is rabies?
So rabies, in the simplest term, is a viral infection. We all know virus is bacteria, but this is virus. And this virus attacks the central nervous system, the nervous system. So when you get a bite, the rabies virus moves from where the bite site is into the nervous system. But the beauty about rabies virus,
There's a beauty.
there's a catch there. Because unlike a snake bite, where it's the signs are immediate, the virus moves very slowly into the nervous system. Now, that is when you start intervening. So our message actually this year was act now, you, me, and community. What does that mean? There's something even the community can do when somebody has been bitten by rabies. It means you can wash the wound. You don't have to rush to the health center if it's too far away. You can actually use water and soap, kawaida, water and soap, and wash the wound. You wash the wound for 15 minutes. So now most people just say, oh, you know, you just here, then you go. Or you just wait to go to the hospital. But in this case, you can actually wash the wound for 15 minutes. That is a message we need to take to the community.
What happens when you wash the wound for 15 minutes?
Now, very good question, Janet. Because the virus is in the saliva. So you see when a dog has kichacha umbwa, they have a lot of saliva, isn't it? That saliva is the one that has a virus. So when it bites you, it sits there. And I said it's a slow-moving virus. So it means it will sit there for a few hours. So if you immediately wash the wound, it means you neutralize, meaning you're washing.
So it's not going
away.
deeper?
It's not going deeper.
It's just there.
It will sit there as it waits. Now, the catch is we all know that dogs have sharp teeth, isn't it? It will go deeper. Yeah, so that's why you need to wash a lot and, you know, running water if you have, or even just water with a bucket.
Soap?
Because we all know. Yes, Lati?
You use soap?
Yes, soap and water.
Okay.
But this is not in place of treatment. You wash it as you await medical intervention?
Yes, as you wait medical. So when we say communities, that there's something you can do as a first aid. So actually our message today, and we have quite a bit of, we've supported quite a bit of rabies awareness by United Rabies Forum videos to show people that there's something you can do. So you first wash the wound, then you seek medical intervention.
When you're bitten, doesn't it also come with blood? So there's blood and saliva.
Yes,
and
yes.
it's still okay to wash that as opposed to treating it with like an...
Yes. So you wash it first, then you can put a disinfectant.
Okay.
Yeah. But the post-exposure vaccine, which now you get after you get bitten by a dog, is very important. And that has also been another gap because one, where is it available? It requires cold chain. Most of these bites occur in remote locations where there is no post-exposure vaccine.
Yeah.
So we say if you wash, you reduce at least 20% of the. Yes. So then now you go and start looking for the post-exposure vaccine. So the gap here is that when a dog is rabid, it just doesn't start with a human. It will bite other dogs. So you can actually track when rabies will happen with humans if you are tracking how dogs are behaving. So with research done, we have several researchers working on rabies at SEMA, and they've shown that when the first bite starts happening between dogs, you have like a lead time of like one month, 2 months for you to start intervening in dogs, vaccinating dogs, before you have a jump into the human or livestock cases. So if we were able to track the dog bites or the dog deaths, we'll be able to save humans. That's one. Then the most interesting thing about rabies is that the rabies vaccine is one of the cheapest vaccines we have in dogs. It's only 60 Kenya shillings a dose only, versus the human vaccine, which is what, 1,500 Kenya shillings. So it is most cost effective to actually vaccinate dogs.
There's
dog vaccine is just 60 bob.
It's just 60 bob.
How much do you pay for your vaccine?
For my dogs, I'm sure it was that, mine were rescues. And rescues come when they've already been vaccinated.
Yes.
So when you adopt, they've already been vaccinated.
But you vaccinate every year, Janet?
Yes,
It's annual.
It's an annual vaccine.
Daktari is like, it's not enough to love your dogs. Vaccinate them annually. The animals listed, raccoons, skunks, foxes, I don't know that we need to worry about that. Bats, dogs.
We need to worry about them because, yes, they are mammals and they will give you rabies. But 98% of human rabies is due to dog bites. So that's why you hear dog-mediated rabies. And our tagline is we need to eliminate dog-mediated rabies by 2030. So we figured out that if you vaccinate the dogs with that 60 bob vaccine and reach 70% of the population, you'll be able to have no human cases.
Why is it unique to dogs? Any scientific research around it, or is it just one of those?
It's just one of those reservoir hosts. There's the virus is like certain hosts, but rabies can occur in all mammals.
All mammals?
Including cows?
Yes, all mammals.
Is it including cows?
Yes, even including cows. You can have a rabid cow. So all the mammals, when you do, and this is where research comes in, this is where we call surveillance and going back to the lab and seeing this rabies virus. Remember, you've heard of genomics? You remember how in COVID we had Delta and So when they do a surveillance, a laboratory surveillance, genomic surveillance, they found that the rabies, even in those livestock, sometimes even in those wildlife, is due to the dog strain. So that's how you track. That's how we know for sure that the reservoir host, the host where the rabies virus is the dog. Yes, and they're the ones who now have these events where it spills over to the human or livestock.
So it's just sitting there chilling, this virus in a dog. What makes a dog go rabid?
Being infected. So there are myths.
But you say it has it.
So
it's infected naturally.
Okay. So the good thing about epidemiology is very interesting. When we say there is of a host, it means this is a host that most often is associated with the disease.
Okay.
But a rabid dog will die. Within 10 days it will die. And that's why when your dog is bitten by a rabbit, it's taken for isolation and you watch and see whether it will manifest the sign. So reservoir means it's just that the virus likes to be in that host. It circulates in that host.
Okay.
And it's circulating in the dog population. Okay. That is why when you vaccinate 70%, it stops. the circulation. It's like a flu. You don't always have the flu. But if you have somebody always coming to your office with a flu, you will always have the flu.
Keep getting it.
That is now what we mean by reservoir host. It's not that it sits there, then one day it decides, okay, fine, I'm rearing my,
Okay.
In that case, would be in a lot of problems.
Okay.
Yeah.
So if a dog gets rabies, it dies within 10 days.
Yes.
And within how long is it mature enough to transfer that virus to me? If it's bitten by a rabid dog today, and it bites me today, and we were just playing with the dog, and the dog bites me.
So we talked about how the virus moves.
Yes.
So if a puppy, let's say, for example, is bitten today, and you do nothing about it, meaning you don't take it to the vet for cleaning and post-exposure vaccination, because we also do post-exposure vaccination sometimes to the animals. So it takes between 2 weeks, depending on where the bite is, because I told you the virus looks for the nervous system, so it depends on where the bite is. From 2 weeks to 1 month. Sometimes we have cases where your dog is bitten, you didn't see the wound, it heals, then one day you wake up and you find the dog has changed its behavior, because we have telltale signs of rabies. So the first thing is that this dog that was friendly all of a sudden starts hiding, starts growling at you, so it has change of behavior, and then the salivation starts. But before the salivation starts, once a clinical signs start, if you're playing with that dog and it bites you or scratches you, and the saliva, you will get rabies. And you remember there was a case, a lady from Britain, she was in Morocco, so she played with some puppies, she got scratches, and she went and actually died of rabies in UK, because they couldn't explain, because people look for bites, but also scratches.
Even
scratches, both in dogs and cats. So that's why we say responsible dog ownership. So the community part is not only vaccinate your dog, but you have responsible ownership to make sure that vaccine is done every year.
So you skip a year and you're still likely to expose your dog
to rabies. The reason we'd say every year in Kenya is because rabies is endemic. So you will find in places like the US, because rabies in the US is more of wildlife, you'll see they give that 3-year gap period. And we've seen, even in terms of research, yes, you vaccinate today, it could cover for more than a year, but the question is, are you sure it's covering? So we say you do annually in endemic areas where rabies is a problem. And rabies infection, actually not all bites cause rabies. Because we have over 160,000 bites in Kenya, but only 2,000.
What does that mean? What's a bite?
A bite is a dog biting you.
Okay.
So not all bites cause rabies.
Okay.
Because there's also an human angle, how you treat, and you'll see from what I've given you, how you treat animals. Because dogs have feelings, isn't it?
Yes.
So if you look at the age group that actually suffers rabies, are young boys under 15. So what do young boys do with dogs? They play with them, they are rough with them, you know. So they end up suffering the most. But then they're also so young that they won't tell their parents, who says, mimi sitaki umbwa, usilete umbwa. So they have a dog they feed in the community, and they won't tell the parents when they've been bitten, because you see now, why were you being bitten by a dog? And we said we don't want dogs.
This Global Alliance for Rabies Control, it's, what do I describe it as, a pamphlet, a document.
Yes.
It's very important because there's a page here that says if a dog comes close to you.
Yes.
Walk us through what happens, because a lot of these dogs in the community just roam around. So you could be taking your walk home and suddenly a dog comes, it's growling, it's salivating. What do you do? The first thing people would do is run, but there's a danger to that. And scream. So what should you do?
So this is what we talk about, education, and education should go to the primary schools. So what do they say? You don't give the dog eye contact. So you look down, you make sure your hands are like this, and you stay still. I know it's a difficult. A
barking dog.
It's a barking dog that it
German
looks like
shepherds.
charging.
But charging
the dogs,
you stand still.
You stand. So what happens is,
and you don't look where the dog is going. You look down.
So you look down. So what happens with dogs? Because they are from the wolf family. If you run, you become prey.
Yes.
You become prey. So you just stand And then it says you stand and don't look. You try as much as possible not to challenge
Don't look at it.
Don't look at it. Yeah. I know it's the most difficult thing to train children.
Okay, what will happen?
The dog could back down because it's seeing you're not a threat.
Could.
Yeah.
Not will.
Could. But most of the time, when you see things written, it is out of more of research and experience. Yeah.
The most likely thing that the dog will do is back down.
It's back down.
After how long? Will it come and continue barking next to me?
It might. But now the thing is, how do you
What does
build...
research say? Once I stand and it stops from there 200 meters and turns back?
So sometimes...
Or does it come close to me?
So sometimes they will attack. And that's why in the next page you see what happens.
If a dog attacks you.
You fall to the ground and you roll up like a rock. And you put your hands at the back. You know why you're protecting your face and your neck? Because once they reach here, that is almost death, sure death. So you see the extremities, it's okay to be bitten here as opposed to being bitten here.
It'll bite your arm, bite your leg, bite your back. But avoid it biting your neck or biting your face.
Yes. So the two are almost like impossibilities.
Yes.
But just like everything in life, it can be taught. So we need a lot of public awareness in schools. And in communities. And that's why for me, my passion is you have to talk to communities on how to behave with dogs.
Is this available to the public or is it just in special
So what we do is when we do the primary school campaigns, we produce and give. And the Global Alliance for Rabies Control are, it's an alliance of specialists, doctors, WHO, everybody there. So now they pour in there.
This is the page that Daktari was speaking to.
Yeah.
I don't know if Jackso can. We'll see if we can highlight it. I just think it's very, very important because this is what people come into contact with.
Yes.
I think about the number of dogs I see roaming neighborhoods.
Yes.
And sometimes I'm nervous. I'm nervous for the kids. I'm nervous for the grown-ups because you can see they're strays.
Yes.
Some of them look very anxious and jittery. Maybe that's the onset, but they're just there. And the kids are running with them and playing with them and throwing sticks at them. So I think this is extremely pertinent because we don't know just how rampant it is.
Yeah.
But there's so many. And I know there's a lot of rescue centers that say, hey, if you see any dog just roaming, please just let us know. We'll come and pick it and we'll figure it out from there.
So Janet, the most interesting thing about roaming dogs, we have roaming but owned.
It goes back home.
Yes, it has a home.
Not all. Some of them look very shaggy, haggard, dirty,
roaming
thin.
but owned.
Some are roaming but owned.
Owned can also be street boys.
Okay.
Wow. You understand?
They have an owner somewhere.
Yes.
Yeah.
And that's what I was telling you, for kids, when we do community mass rabies vaccination, it's actually very interesting how you'll find one kid who comes, yes, he's from the slum, but he has 15 dogs that follow him. So those dogs are owned because what does this boy do? He feeds
them.
Whatever he's given at home, he comes and feeds them. So in essence, they are owned.
Yeah.
They might not have the tag on your vaccination card that you have, Janet, isn't it? But they are owned by somebody.
Yeah.
And that is now what we leverage on when we're doing mass rabies vaccinations. Yeah.
I know later when we'll come and talk a little bit about certain communities that seem to be doing really well in eradicating rabies.
Yeah.
But before then, because of the context of our country, there's a lot of, farmers or pastoralists. How rampant would you say it is in cows and goats and sheep and camel in Kenya?
All right. The rabies in livestock, I would say, is not as common. So we have estimations of about 200 deaths in dogs, fewer in livestock, because we say the rabies in livestock comes from dogs. Yeah. So a species that we have seen increasingly that is having an issue is donkeys. And it's mainly because of the way the donkeys are reared. You know, they are not, the owner, once he uses it for the day, then it's allowed to roam wherever it needs to be.
Yeah.
Yes. So then they are bitten and maybe the owner won't know. Then you have rabies, So we do have, but it's we call it, there are very few cases. They are sporadic. They are spread out in the ear. But dogs are their main.
How about cats?
Also cats. Yeah, also cats, but it's also minimal.
How prevalent is it? I mean, dogs and cats will always have a tiff.
Yes. Yeah.
I can imagine that the likelihood of a dog biting a cow and a dog biting a cat is higher on dog biting cat.
Yes, it's higher on
and
cats.
the cat is domestic, so it's in the house. It's being played with. I mean, and all. Yeah. So, how many cases do we see
for cats?
For cats.
So, dogs, we have quite a number of, I would say, data, because when they die, then you can take it to the Central Veterinary, the Kabete laboratory. But cats sometimes, because of their nature, you probably run away and die somewhere and you'll not know. Because remember, the first thing about rabies, it changes its behavior. So this cat's likes lounging on your seat or on your lap. All of a sudden, it disappears. Yes, it disappears. Or when it changes its behavior and scratches you chopper it, and then it goes. Yeah, because you see, remember, it's the nervous system, so it becomes deranged. So most likely, it dies outside. So we get very few cats submitted for rabies examination, very, very few. So the fact that we don't have reporting, we don't have them submitted for laboratory diagnosis also limits us knowing what is the prevalence in cats in Kenya. Yeah.
Is the are the telltale signs the same in all animals?
All, even human beings.
Even humans,
the same. Change in
saliva
behavior,
and all.
Saliva, for humans, hydrophobia, meaning you fear water, and mainly because your nervous system is affected. When you start eating, your throat contracts, So in your head, as much as you're lucid, you know that you don't want to eat anything because it's painful. Yeah.
And it can take a matter of what, days or the same day?
The same day. Actually, we just say within 10 days. Yeah.
Oh my goodness.
Yeah, so just one of those things that we never want to see human cases, because if a doctor sees a human rabies case, it's very traumatizing.
Okay. Yeah. Let's actually talk about it.
Yeah.
Because there are 200 people who die every year. 2,000 who die every year in Kenya. From rabies. So what happens when somebody is bitten?
So if you're bitten and you don't do the steps, remember the rabies,
washing for 15 minutes.
It's 100% preventable, even after a bite. Washing and doing the post-exposure vaccines, which are you've had those many vaccines, day zero. Day zero is on the first day you present yourself. It doesn't have to be on the day you are bitten, the first day you present yourself. So the myth with regard to human rabies vaccination post-exposure is that, if a week passes, you can't get it. No. You get it as long as you are not showing clinical signs. So on the day you present yourself becomes day 0, then you get one in day 3, then you get one in day 7. So if you have the 3 shots, you become protected. But then especially because of severity, we do day 21 and day 28.
So you get 5 shots.
So 5 shots. So now the 3 shots is what WHO says, yes, it will be protective. But because of most of the time the wounds are very severe, you want to go through to the 5 shots. So that's where the problem is. Because how do you adhere to something for 5 shots and you live where?
And so you're far from the facility?
Yes.
And you're already feeling a bit better?
Yes.
After the 3rd shot, day 3, I went. Day 7, I went.
Yeah.
Siniko sawa hata nimesikia nimepona.
Day 21, most of them days are
people
high.
Don't come back.
People don't come back.
Okay.
Yeah, and that's where now the problem is. So another problem also is the vaccine. Do you actually have a vaccine that is working? Did you maintain the cold chain? So those are the critical, because this vaccine is cold chain dependent. Yeah. And sometimes if counties or health facilities buy more than one, the vials that have multi-dose, multi-vaccines, if you open that vial, you need to discard it. So most people they'll use the one, then they think they can use across the days. That is ineffective.
Wow.
So, there are very many little things that gaps that have to be addressed. And one gap is a single dose vaccine, so that the healthcare provider doesn't have to consider, I'm discarding 9 doses versus just 1. Yeah. Then another thing is also the healthcare workers, both public and private. you don't give tetanus, because that's what they do. They give tetanus and they cheat somebody that, yeah, you got vaccines. But when we go and investigate, there was no vaccine given. It was just tetanus.
Hold that thought, Doctor. We're going into a break. We'll come back and start with that. And how you can tell whether the patient writes in trying to understand, what have I been given? What should I ask? What do I need to follow up on? And whether once you've been bitten, and even if you've been treated, do you then need to be treated every year, or is it just one-off and you're done? There's also Marsabit recorded 0 rabies cases in 15 villages. I want you to confirm that later. And if it's true, what did they do differently that brought the numbers down? But we are in conversation with Dr. Pauline Gitonga, veterinary surgeon, talking about rabies. I know the mouth.
How do you say that?
Veterinary surgeon.
Because it's written veterinary. Is it vet?
Vet. Just call me a vet.
Okay, no, but in full, is it?
Veterinary surgeon.
Oh,
so
veterinary.
We ignore the
the Rian sometimes people could say.
So it's just veterinary.
Veterinary surgeon. It's coming up to 7:30. We'll be back in conversation with Dr. Gitonga. Sure.
Asante sana. We're continuing our conversation with Dr. Pauline Gitonga. She's a veterinary doctor and also a senior research fellow at the University of Nairobi, and also working with the Center for Epidemiology. They deal with epidemics.
Epidemiological
modeling and analysis. Dr. How do you start your day? Do you start your day with a heavy meal, or do you end your day with a heavy meal, or do you do heavy meal in the middle of the day?
I do heavy meal in the middle of the day.
In the middle of the day?
Yes, but I have to have my coffee in the morning. Yes,
We are aligned. Coffee.
Coffee lazima. And then lunch hour. Now watu wakae kando kwanza ukule, then you'll deal with them later.
Sometimes where you are. If I'm in the office, yes. But even I feel lunch is a myth.
Wow.
You may push.
You will push on.
Whenever you have your heavy meal, and I know because we're Kenyans, we do those heavy ones. We do ugali. You know, sometimes you may want to do ugali alafu badala ya chai ukunywa na uji.
Ndio shibe
kabisa. Or sometimes chapo. Think of layer. Layer is layer premium fortified maize meal. Okay?
Okay.
That one for ugali is the one.
All right.
It's the one. Remember, premium, fortified. Those things mean something. Those two words. Premium is because of how it's been sifted and graded. Best quality maize, how it's taken through the milling process, premium. And then fortified is because they have, and you know, you are a vet doctor, so you also know in terms of nutrition, even for animals. We are animals as well. It's fortification with added nutrients that you need for your body. And this is allowed by law. The millers are actually expected to look at the quality of the meal that you're selling, and you fortify it so that the person who's eating it gets proper nutrition out of it. So you get it full. Layer, premium fortified maize meal.
She live with that in mind.
Yes.
You live with the words going through your mind. And let us know how much you enjoyed it. Before the break, you were talking about...
We're going to give you a cup.
Oh, yes.
When Leo...
By the way, I can't wait to enjoy some
Leo
of that.
Sapa tunakula Leo.
Of the next few days.
Bora tushibe.
You've already come up with the tune. The kajingo. Before the break, you were talking about doctors administering tetanus shots, but claiming they're rabies shots. Is that what you meant?
Yes.
Okay.
So in some instances, and that is why you have to empower the community, that when you go and you've had a dog bite, you have to actually ask the health provider, what have you administered it? Write in my card, because everybody goes with a little card. We have vaccine manufacturers who actually produce a vaccination card for you. Sorry. That
Go on.
that when you're vaccinated, they actually write the batch number and the type of rabies vaccine that you've been given. So as a patient, you actually say, yes, what have you given me? Write it down.
On the book.
On the
booklet.
On the booklet.
Okay.
Yes. We have to be proactive.
This is a booklet for human booklet for...
Human booklet. There's that small rabies card that is there. And even if it's not there, because sometimes it will not be there, have them write a small note. So if anything happens, somebody would know what is going on with you. Because remember, if you start showing signs and you're vaccinated, then that means there was an issue with the vaccine. But if you show signs and there's no record of where or what was done for you,
then we don't know.
What
caused it.
So
I have a couple of issues here though with our health system. Number one, you said that this post-exposure vaccine specifically will require cold chain.
Yes.
Right?
Yeah.
It needs to be refrigerated.
Yeah.
Which means that it needs to be in a facility that will be able to keep it refrigerated.
Yes.
The best place for this would be in the next dispensary.
Yes.
So that you get a bite, you rush to the nearest level 2 facility and you get it. Do we have level 2 and 3 facilities with cold chain?
Yeah, so some have, and sometimes you leverage on their immunization fridges, yes. But one thing the counties have, and they're doing very well, I think the county like Turkana and Kajiado are trying, is that they have select facilities where all healthcare workers know if there's a dog bite, refer them to this facility. So if you make this information known for both the public and private, and that's a beauty sometimes with these ASAL counties, they work together, both the public and private. It's not like Nairobi, where you don't know what the private are doing. And then you tell them you go, for example, to Mashuru, for example, or you go to the referral, depending on how far. So one thing about rabies vaccine, if the county does their due diligence and designates certain health centers as a rabies centers for vaccination, then you are going to be fine. And as I told you, it is not like a venom where you're looking, running out of time. Is that, yeah, you can have, as long as you've done the washing for 15 you've done
minutes.
the iodine, because iodine is a very good disinfectant.
What's iodine? Salt?
You know the brown thing when you are young, the iodine that you're backward as a disinfectant, it's also very good. It works because it has...
It's called Magadi.
No, not, oh my goodness, not that
Magadi one.
It's a betadine iodine. It's even also a mouthwash. Yes. But we have a lot of it for wound management. Yeah,
so you should have that at home?
Yes, you can have that at home. Okay. Actually, most parents have it at home because you always have these scripts and scraps for the kids, especially when you have boys, isn't it?
Yes.
Yeah.
I have
my GV, the money.
Yes, GV still.
Yes, GV is still also iodine.
GV still works magic. I mean, I just remember it as a child. Both that Dr. Ari has mentioned, betadine
with a purple patch.
Yeah, now with 2 dogs and 2 sons, they're just all over.
So GV is fine.
So GV, yes, iodine, because it has an iodine.
But this is after washing.
After washing for what?
For
15 minutes with soap and water.
Soap and water. Yeah. Then you put a disinfectant. Then now you start tracking. Where am I going for my post-exposure vaccines?
Okay.
Yeah.
And then you are not in pain, right? So you're not losing consciousness as all these things are happening.
The pain is there because you've been bitten.
Yes,
and then remember also this is a dog's mouth, so there's also antibiotics you might have to go into. That's why we say you have to seek medical attention. So don't sit after washing
on the same day
and putting iodine. On the same day, now you start looking for where you're going to be vaccinated. When you reach there, you should tell them, okay, write for me down what you have given me. Yeah.
From what you've done with the work with many counties, how would you say is their preparedness for dog bites?
Well, I'll say they try. And I'll tell you why.
You know, they try is a very Kenyan thing to say.
I know, they tried.
Wanajaribu.
But you remember, rabies is neglected. How many deaths occur due to malaria or pneumonia? We're talking 10,000, 9,000.
Yes.
Yeah? And then rabies can be so sporadic, meaning this year you might not have a case, next year you don't have a case, then the third year you have all the cases.
Yeah.
So you have this vaccine that has been seated in your stores, expiring. So there's also that thing that where counties have to talk to each other. Where are the cases? Can we ship our vaccines to you before they expire in our stores?
Okay.
So that network needs to be created. That's why I'm saying they're trying, because they will, like now we are having a resurgence of rabies cases in Kenya. So they've bought the post-exposure vaccines, they've bought but then now the cases will go down and maybe it will go down for another 3 years. So what do you do with those vaccines you had bought?
Okay. So have you done that work, working with the Council of Governors, with the counties, to have them create that kind of network? To understand, first of all, that, it may not happen this year, but it could happen next year.
Yes.
Or it may happen at the end of the year, and you will be unprepared. And this is how you can then do it better. Have you done that?
We are doing a research, because everything is informed by research. There's no point of telling people, do this, when you've not identified where would be your rabies centers of vaccination. So there's a student at SEMA who is doing now the networking. What does networking look like? Who do we procure the vaccines for? Do we do 5-year expiry, 10 years expiry? You say, because you also need to talk with the industry, the pharma companies, to make sure that they have a long expiry vaccine, those to cater for these eventualities where we don't have cases in the year.
You said right now there's a resurgence. What causes that?
Of the break. because first of all, COVID, there was a dip. There was no rabies because there were no people to be bitten, isn't it? It was, So you give rabies, if you vaccinate, you give rabies 3 years. After 3 years, you're going to have an outbreak.
Okay.
Because the vaccine is able to be protective for about 2 years. But in Kenya, as I said, and I have to stress, we say vaccinate every year because it's endemic and you're not controlling the dog population. Unlike in the US where you have to neuter your animal. In Kenya, we have very few doctors who can do that. So we say you maintain at 70% vaccination. But it has been shown, and this is ongoing research, that in our setup, if you give a dog a vaccine, it could be protected for about 2 years. So for us, the 3rd year is a critical. So as a county, if you have done very good vaccination for the first and 2 years, you have maybe a leeway of another year or 2 before the resurgence. So currently, the resurgence is there because there was a break in vaccination. And the break happens because there were no cases. So the policymakers forget. So if you have money between this and malaria drugs or pneumonia drugs, you take them to where? To where there are more cases.
But if they know there's a pattern, what's contingencies there? If you know that if science can track that these things happen, shouldn't there be just like a contingency so that it doesn't happen, then in the 3rd year suddenly there's an outbreak? It should almost be there's a preventative or...
contingency plan, you've called it well. So what countries are doing, we have something called the Zoonotic Disease Unit, ZDU. It's been in existence. It's the one that gave us a rabies strategy. We have a strategy of 2017-2030 strategy. What the countries are done is they are encouraged to form what they call County One Health Units. The County One Health Units sit, and they're the ones who keep rabies conversation on the table for the governor. And this unit is made up by most of your ministries or your departments, that is health, livestock, environment, because remember we have rabies in wildlife. And in the health, you have the public health, you have the nurses. So they sit and say, okay, what is our rabies stock? And if we have this, where do we spend the money? So we encourage counties to spend the money on giving the vets the money to vaccinate their dogs. You're better off using that money in dog vaccinations than having it held up in vaccines that you might not use.
Makes sense.
So if the County One Health Unit is able to talk to the governors and give the health sector money, the vet money. So as we decide this is the budget for dog vaccinations, it will get done.
Before we move into what's happening in, or what kind of controls are happening in different parts of the country, looking at cases in Asal region, for example, it's a viral infection, which means it's contagious. If I'm bitten and I'm going to hospital, my first thing is, am I also going to spread that to other people?
No,
or not necessarily.
Unless you have the signs. So that's why I was saying rabies is one of those diseases. It's very easy to control. If you're bitten today, of course, you're not going to show signs today. And if you do the first aid and you get your post-exposure vaccines, you're not going to transmit it. But when you start showing signs, and the signs, as you have seen, is almost like the dog. You're going to salivate, you're going to have you won't have your mental capacity will be gone. So you'll bite somebody. And anybody who is taking care of you and they are bitten, of course, you are likely to transmit to them. But we don't like to get there. We don't like to get there. The healthcare workers, in terms of how they handle rabies, is more they actually just put you in a coma, and monitor you and just, and cancel the family, but we don't want that.
No.
So most monies, I would say, counties should concentrate on giving money to the vet departments to vaccinate dogs. And then do dog population control. As much as you're talking about roaming dogs and population, studies have shown that as much as we want to control the population, it's a very expensive venture because we don't have, like women, an injection that controls. You have to go and do in surgery, and you have very few vets in the country, isn't it? So we focus on mass rabies vaccination because it's very expensive to run surgical campaigns. We have tried. You spend a surgical campaign, 1 million versus 60 bob. 1 million divided by 60 would be how many dogs have you vaccinated? So it's to get the vaccination going. And even those roaming dogs, as I told you, are community dogs. There's somebody in that community who can hold them. And we've seen it time and time again. You go to the slums, you ask, okay, bring your dogs. You have the street boys coming in with They are a pack of 10 dogs, 15 dogs, and they can hold them, so you vaccinate.
Okay.
Yeah.
Now talk about the drylands areas. I know before I mentioned a certain statistic for Marsabit, but go granular. What's the level of awareness, and what are some of the interventions that you're beginning to see working?
All right. So we did what we call a knowledge, attitude, and practice in the 15 villages. So here there's a caveat. We picked a village in 2023 that was having high dog rabies cases and a few fatalities in human. It's called Loyangalani town. Loyangalani town has 15 villages. So we sat there for 3 years. But before we started vaccinating, we did a knowledge, attitude, surveillance. What is your level of knowledge of rabies? We actually found it to be very high. But what is the challenge? What happens? So in some of these pastoral communities, you have also a bit of interference with their culture and tradition. Dog bites and snake bites sometimes go into what we call traditional medicine. Yeah. So when somebody is bitten by a dog or a snake bite, they would probably first seek a traditional healer before they go to the health center.
There's a stone that sucks out the
yes. So those are some of the challenges. Poison. So we found that they understand rabies. They understand rabies is from dogs. They understand you're supposed to seek, but also that town suffers from periodic electricity shortages. So as we said, electricity, cold chain is everything. But in the 3 years we've been there, and the 3 years we've been able to vaccinate, we tried to vaccinate about, we did an ad hoc census, and we saw they have about 2,000 animals. So we tried to vaccinate about 1,200 dogs every year. And this has been our 3rd year. And even if there's a dog bite, the dog that has bitten you has been vaccinated. You understand it? So it's proof that if counties and actually commit to 3 years vaccination consistently, they could actually eliminate. We talk of elimination, not eradication. Could eliminate dog-mediated human cases. Yeah, eradication. We have only two diseases in the world eradicated: smallpox in humans and rinderpest in livestock. So we talk of elimination.
So it's elimination.
Yeah, it's elimination.
So if you do a 3-year consistent campaign, then you
drop the cases.
You get to that level of dropping the cases.
Drop the cases.
But that does not mean that you now stop vaccinating.
It doesn't mean that you stop vaccinating. You just make sure you continue. Yes. So when we say 3 years continuous is when you go to a new area. If you want to drop the cases in dogs and humans, you make sure you do high-level vaccination for 3 years. Then after that, you can start now looking, okay, the new cases, the puppies that younger than 2 when the last time you're there. Yeah.
Is there a goal, even if it's globally, in terms of how many numbers or the numbers to bring down in terms of rabies cases? Is Kenya on track, or are we...
Yeah, as we say, 0 by 2030.
Okay, 0 by 2030.
Yes, 0.
What does the global data say about rabies infections?
59,000 deaths.
Oh, 59,000. Okay.
59,000 deaths.
59,000 deaths.
Yes. 59,000 deaths. So it's 0 by 2030.
Have the deaths gone down? If you looked at the last 5 years or decade?
We can't say that. Why did I say that? Because of surveillance. We have very weak surveillance data because we don't have data on how many dogs die. Remember, communities will take action when a dog is rabid, they'll just stone it. But they won't necessarily report it to the vet or to the human side. Yeah.
Globally? I was asking about a global glance in terms of...
So we have success stories. We have success stories in Tanzania. Zanzibar were able to take their 0 rabies, Zanzibar itself, to 0 human rabies cases. You understanding? Yes, with that sustained. So we do have success stories, but there are pockets. As you appreciate, even Marsabit, we have a pocket in Loyangalani. Yeah.
Wow. So... From where you sit as an academic, as a researcher, and working with the coalition that you work with, do you see a proper understanding and a sense of urgency by policymakers on these things that you're recommending? Like, start with understanding. The understanding first. If they understand, fine. The next thing is that, do they see the urgency?
Yeah. Understanding is there. And as I said, even the community understanding is very high. They understand what Kicha Chaumbwa is. Now, it's the resource allocation. And as I said, we have to figure out on the times when we have a dip, when you have no human cases, what do you do with the vaccine? Yeah. So what our message actually to counties is very simple. Spend money vaccinating dogs. If you have a budget line in the human health budget for rabies vaccines, give it to the vets to vaccinate the dogs. You probably might not need to spend your money in humans. If we reach 70% of dog population vaccinated, that is that simple. Yeah. Priority on dog, mass dog vaccinations. We have numbers to vaccinate in terms of staff on the ground. We have strategies that work. So they understand rabies is a problem, but because it's sporadic cases, 200, maybe 10 versus your 5,000 or 3,000 deaths in malaria, they lose there. The highlight is not there.
It moves.
Yeah.
Any that you can highlight here as, one, it could be a case study. Any county that you can say, for the last, outside of the non-governmental entities working in the area, the county government itself has actually, we've seen them dedicating resources and so on.
So the rabies strategy started with what we call pilot counties, Busia and Makueni. So Makueni have done an amazing job because, yes, they were a pilot county to eliminate rabies, but the government has also taken up that mandate to vaccinate. So they do very well in vaccination. So Makueni is your case study. Yeah, Makueni would be your case study on rabies, because yes, they figured out the post-exposure vaccines, where they are. Everybody's aware where to get them, but they do very good vaccination.
Keeps coming up. Makueni.
Yeah, Makueni.
Good thing. Do they? So reptiles can't give you rabies.
Can't get rabies. They're cold-blooded.
These animals cannot get rabies, and therefore they cannot give you
rabies.
Okay.
Yes,
Okay.
So that's a very simple.
This is lizards and snakes and such.
Yes, and birds also.
And
fish. And fish.
Okay.
Yes,
But mammals can.
All mammals can get rabies.
Okay.
Yeah, and transmit it.
Okay.
Yeah.
Okay.
This is a very resourceful.
Yeah. And then that little one teaches you how to behave, how to be a responsible dog owner, how not to abuse dogs. Because remember, when dogs are bitten, they've become fearful of humans. Yes, and that's where you get your bites from. But I said not all dog bites give you rabies. Yes. Some are because you have mistreated it, so it has fought back.
Okay. At national level, Ministry of Education, how closely have you worked with the Ministry of Education to then take this information? Like you said, it's young children, particularly young boys, who need to have all this information, but also all children need to know what happens. What do you do when a dog starts barking and charging at you? Like how you work in the ministry to take this information to schools, not you doing campaigns in 5 schools, but it becoming the normal thing that all teachers.
So I talked about something called the County One Health Unit. We've and in the County One Health Unit, we have the Ministry of Education representatives. We have good working models where associations like AMREF support what we call a multidisciplinary team that goes to the ground. So this team has healthcare workers, has educators, has vets. So when they go down to the ground, the healthcare workers will do, your measurements for malnutrition, vaccinations, the vets will vaccinate dogs. Then the Ministry of Education staff will go into the schools and provide this awareness. It's in very small counties. We are hoping that model can be adapted by the other counties where offering service is made more resource effective by having most of the disciplines working together. And when you go to the ground, like if you go to Meto, for example, in Kajiado, and you go, all the professionals there, and everybody has their role. The Ministry of Education staff are in schools doing the campaigns. The doctors are vaccinating dogs. The humans, you're being educated, by the way, if you're bitten by a dog, this is your first aid, and then these are the facilities that you have. So that's the model. I know it has not... these are things that we've been pushing since the Zoonotic Disease Unit was but it's been 10 years, slowly gaining traction. Makueni is a good county. Busia also is a good county. It's a model. Okay. And the model sits with the County 1 health units. They're the ones who will keep rabies discussion alive.
Robert is saying, haven't seen them in Nakuru. I'm not sure whether he means, who would he not have seen in Nakuru?
Could be the County 1 health unit. I don't know. Okay. Yeah.
He let us know.
He let us know. It's the vets. But the vets, so the thing about most vets offer, especially when you have outbreaks, most of them actually offer rabies vaccination as a free service during outbreaks. It's part of our, almost like CSR. It's, you see, you take an oath to protect the public.
Yeah. Okay.
So when you have outbreaks, most of us actually mobilize ourselves and give free vaccination services.
Amazing. Dr. Pauline Gitonga, veterinary surgeon and senior research fellow, rabies awareness. Yes. Very informative, very helpful. Thank you so much for sharing that. Is this for Daktari? Okay.
Layer.
Thumbnail. You know, you have to do a thumbnail. Premium.
All-purpose fortified wheat flour.
Enjoy. You're sorted now.
Thank you.
Do enjoy yourself. Let us know how you enjoyed the meal.
Yes.
Keep us posted. But thank you so much. From one set of awareness to another, in the next 2 hours, we'll be covering the spectrum of dyslexia. We'll be speaking to somebody who lives with dyslexia, has children who do it as well, and an expert, a doctor, who will talk to us a little bit more about what is dyslexia. It's coming up to 8 a.m., Fixing the Nation, one conversation at a time. We'll be back in a bit.
Thank you.